Hello everybody, thank you for making time to join us. I'm Peter from the Neonatal Network Support System. The Neonatal Network Support System seeks to help address the high rate of newborn deaths and the long-term complications in our country, especially in the rural and the poor communities. Currently, it is estimated that newborn deaths, that is deaths within the first month of life alone, account for up to about 40% of all child deaths below the age of 5 years. And I must say that in our attempt to help in this regard, it will be unfair on our part if we fail to acknowledge the great efforts of the government of Ghana through the Ministry of Health and the Ghana Health Service, and institutions such as the Japanese International Cooperation Agency and the UNICEF in newborn survival in Ghana. But unfortunately, this is where the majority of us as people err. We give up our responsibilities as citizens towards our newborns and leave the fight to these big agencies, who usually have more than one challenge on their hands to fix simultaneously. We at the NNSS are of the view that what is lacking painfully is a community-driven, dedicated channel for newborn health. A society in which the ordinary Ghanaian becomes the champion of newborn health. Today, most people either easily accept newborn deaths as a norm, or at best mourn their person briefly and move on with their lives as though nothing has happened. They move on and then simply await the next pregnancy. And that is an event which none of us can predict with certainty to assure parents of the replacements they desire. Let's take a moment and think of the countless childless couples that lost what may have eventually been their only baby, their only sunshine, and have been struggling ever since to get another. Besides the countless babies that die yearly, is the huge number that have to live with debilitating results of cerebral palsy and other effects of birth asphyxia and neonatal jaundice, just to mention a few. Many of these preventable deaths and disabilities occur because there are geographical inequities in healthcare staffing and facilities across the country. If we assume that the government alone or these donor agencies can mobilize the needed resources to address the challenges within a reasonably short period, will be an exercise in self-delusion. And sadly, whilst we wait, many babies continue to die. We need to take a radical approach. In the scheme of things, we realize that midwives and other frontline healthcare staff have no option but to refer very sick newborns to facilities that can take care of them. We realize that most of our rules too are bad, and that these staff will only learn and improve upon their practice if they receive appropriate feedback on a regular basis and, if possible, in real time. Unfortunately, many of these midwives and other frontline healthcare staff are disadvantaged in that they either have no mobile phone call credit at the time of referral, and even if they do, they probably know nobody at the other end to hear their desperate cry. This is the primary basis for our newborn care call network. For the institutional challenges in healthcare, challenges with newborn referral and feedback, we present our community-driven newborn care call network. For that abandoned baby that needs emergency medication, or that baby with a surgical condition that sometimes is not covered by our insurance, our approach is to mobilize funds and then distribute in a sustainable way. For the countless mothers and caregivers who, with a little more targeted newborn care information, will take a positive step to avoid newborn infections and complications, our approach is to strengthen education. To the questions of sustainability, over the medium to long term as to how we'll be able to reach newborn babies. Our approach at the Newborn Network Call System is to adopt what we call the social entrepreneurship model. This is our passion. We believe that until society as a whole gives priority to newborn survival and well-being, we will soon have no children strong enough, no children intelligent enough, or emotionally strong enough to access any child-based policies we may implement for them in the future. The time to act is now. For as they say, the first cut is the deepest. We aim to get it right, and to get it right the first time. The world we live in will always present competing challenges, but our call as humans is to help preserve the custodians of our very existence, the ones assigned the task of propagating humanity into the future, none other but our precious newborns. At the NNSS, we envisage a world where every newborn born anywhere on the planet arrives to a hero's welcome, to a standing ovation, regardless of whether those applauding his or her arrival have enough to live in mansions or have barely their tents to abide in. We welcome you to join our cause to save our newborns, and you could help in any of the following ways. You could be an advocate, spreading our message in any way you can, including social media. You could be a volunteer supporting our newborn care educational programs to others. Or if you have the resources, you could also help by funding some of our projects. We want to thank you for your time listening to us, and we look forward to hearing from you. Thank you very much.